Have you ever woken up with very loud snoring, or you've been told that you snore? Woken up feeling very tired, groggy, woken up with a headache, and frequent trips to the washroom at night. These could all be symptoms of a condition called as obstructive sleep apnea. So, what is obstructive sleep apnea? Why does it occur? How to confirm this? How to treat this? Is all that we will discuss in our video today. So, firstly, how common is this problem? You'll be amazed to know that almost 1 billion people all over the world have this condition. And Indian data says anywhere between 90 to 100 million. So it's really very large numbers. But the other thing is that almost 80% of people are remaining undiagnosed. And why is this important? Why is it important to diagnose this condition? We know that untreated sleep apnea or sleep apnea, if not recognized, is a risk factor for cardiovascular disease. That means it makes you more prone to develop either a heart disease or a brain stroke by at least 2 to 3 times the risk. It's also associated with high blood pressure, again increases the risk of getting a higher blood pressure. So people who have high blood pressure and snoring should definitely get tested. Or those who have high blood pressure, obesity, snoring, and require more and more medications to control the blood pressure, those people, almost 70%, might have underlying sleep apnea. Similarly, with diabetes, sleep apnea can increase blood sugar, and also those with diabetes, it can impair the blood glucose control. That can also cause changes in immunity. It can cause changes in your mood. It can cause irritability and depression. So what are the common symptoms? How does one recognize, and how do you do like a self-test that do I have sleep apnea, yes or no? So first, and the cardinal symptom is snoring. The snoring is loud snoring, habitual snoring. That means most of the nights there is snoring. Snoring with sometimes either the bed partner or you yourself may have woken up with gasping, choking, difficulty in breathing. And this can also be accompanied by fast heartbeat. The other thing is that you're waking up with headaches is another symptom. Frequent trips to the washroom, often mistaken for things like prostrate in men or diabetes, but it can or is a symptom of obstructive sleep apnea. And irritability, forgetfulness, foggy head. So these are all symptoms of obstructive sleep apnea. So why does it occur, or what is this condition? To show you this is the nose part. This whole thing is called as the breathing passage or the airway. This is the tongue and this is the throat and this is the part in the neck. So usually this is an open pipe. We breathe in and breathe out. There is no sound. But snoring is a sound when this is a little narrow. And when this gets totally blocked or obstructed, and that is what is called as obstructive sleep apnea. So these pauses can occur multiple times at night, and we have gradings of the severity, but each pause causes stress for the body, resulting in breakages in sleep, increasing in blood pressure, blood sugar, changing in your arteries. So that's this whole cycle which goes on at night. So how does one test it or confirm this diagnosis? After we have talked to a patient, then we do a test which is called as a sleep study. This is an overnight test. We measure activities from different parts of the body, starting from the brain, something from the muscles, snoring. There are belts to measure breathing. There is something to measure the oxygen. And this is measured through the night. This is what is called as a complete sleep study, usually done in the presence of a technician. But then we have some simpler techniques now, which can also be used like screening. And out of that, one of them is this ring-based device. So this is worn at night, and it is capable of recording the oxygen, the breathing, and your sleep. So thus, this is another tool which can be used, and there are similarly some other tools. So what to do? You've been diagnosed, you have the symptoms, but the good news is that this can be treated, or it's a treatable condition. So how is it treated? First and foremost, we look at what could be the cause. So is just weight a cause? Then we focus on the weight and the lifestyle management. Is there something to do with the airway, particularly in children? They have a lot of nasal obstruction, adenoids, and that is amenable to surgery. Or is it just a narrow airway? And then the smaller chin, smaller jaw, and this could be familial. But the most or the standard form of treatment is a device called as a PAP. What it does is it gives air under positive pressure and it keeps this airway totally open. So that is the mainstay of treatment. But yes, there are other measures as we discussed, like lifestyle measures, weight management, changes in your consumption of alcohol, and surgery in a few patients. And there's also something called as dental device, which is worn over the teeth. So which patient, what kind of a treatment to offer depends on the individual. So I'll just share a simple story with you. I saw a patient the other day, 45 years old male, working professional over the years because of sedentary lifestyle, sitting and working from home, has now gained about 20 kilograms, is now 100 kg, BMI is 38, has blood pressure is slightly going up, sugar pre-diabetic, and came because he's feeling very unrefreshed even after sleeping sometimes 8 hours, 9 hours, and not able to concentrate. And the worst scenario was that when he was driving recently, he went off the road. And then, yes, there was history of snoring for very long. So all these symptoms put together, highly suggestive of a condition called obstructive sleep apnea. So we did the study, found it to be positive, and used the PAP at night. Just one night of usage. And he said, I feel that I have never woken up like this ever since. And after now 3 months, he's in a much better place. Quality of life is much better. Blood pressure has come down. Sugar is down. Energy levels are better. And he's lost 8 kilograms of weight. So yes, if you know or have any of these problems or know anybody with this, do get them tested before we have a major catastrophe and improve the quality of life. So do share, like, subscribe to this, and any thoughts that you have, any questions, you can let us know and we shall answer them for you.